Hello guys, thank you so much for joining us today. My name is Dennis Duko Nyala. As usual, I bring you stories that you've not seen elsewhere. And now today we're going to talk about some of the diseases that affect rabbits. And with me, I'm joined by a veterinary doctor. Good afternoon, Sebo.
Good afternoon.
How are you today?
I'm okay.
I'm super glad to be talking to you today.
I'm glad to.
So we want to first of all get to know who you are exactly, what's your name, what you do, your profession, so that people get to understand from your perspective.
So I'm by name Zirwawi Badlu, a veterinary officer.
What he's trying to say is he's been a farmer himself and he rears actually rabbits. So we're getting not just from a veterinary doctor, but rather from somebody that has also experienced with something that is more technical than most of us are. So let's start with rabbits. Do rabbits oftenly fall sick?
Rabbits has like other animals. When mismanaged, obviously they do fall sick.
What do you mean by saying if they are mismanaged?
With mismanagement, we mean in case you don't follow all animal husbandry practices in right ways like hygiene, feeding, and the other managerial work we can do in the farms, as you can see.
Okay.
So if you take care of rabbits in very proper ways, you will meet few diseases to manage.
Okay.
Yes.
So let's start from what are the diseases that are quite rampant when it comes to rabbits?
For the few rampant diseases, at least we have coccidiosis.
Okay.
It very much disturbs rabbits, but it comes as a result of poor hygiene. If you cannot maintain hygiene in your rabbitry unit, you likely to have problems of coccidiosis, but it is manageable, treatable, and it cures.
So what are the signs for coccidiosis?
So coccidiosis, if you meet diarrhea, more so blood diarrhea in rabbits, you obviously begin to suspect coccidiosis.
Okay.
And progressive emaciation, if you see a rabbit losing a lot of weight in very short period of time, you begin to suspect you may be having coccidiosis.
Okay.
Coccidiosis, we use sulfur drugs.
Okay.
We use amprodium, we treat the environment where rabbits are, we try to see how the hygiene of the unit is, but specifically if it persists, we bring in sulfur drugs like amprodium, amprolin, coxid, and we manage the treatments. There are more diseases like pneumonia. It is very much common in rabbits also. If the setup of your farm is poor, you're likely to have pneumonia. More cold, it comes as a result of overcoldness within the unit.
Pneumonia, you mean the coughing and the sneezing that we usually see in rabbits?
Yeah, there is coughing and sneezing, has flu, it's soft, but pneumonia is a situation when you have managed the coughing, you have managed the sneezing, but it has persisted.
Okay. So
you may have pneumonia at the farm unknowingly, but when you learn into a specific diagnosis, then you will know, you will properly identify which one is which, whether pneumonia or flu or colds or sniffles.
Okay. Some people say that sniffles are normal. Is it something normal that we should just treat it normally, or we should take it as a serious threat to rabbits?
Sniffles is not normal. It is a disease true like flu in human beings. So, but we can properly manage sniffles. We take them as a viral disease of a rabbit, like as in flu, like for human beings. So, biotically or biologically, we have a tendency of saying viral diseases we just manage by symptoms. They don't completely cure, but we manage symptoms according to what we see. But with sniffles, we go in antibiotically and we manage sniffles. So more diseases we have bloat. Bloat is also a disorder in rabbits. It brings losses to rabbits if you do not properly follow the procedures of management. Bloat, it is a situation when a rabbit overfeeds on the matter that it has overeaten a lot, and the ingester cannot it cannot digest well all the ingesta it has taken. So in the due process, you find the stomach, it has overextended to the normal size.
Okay.
So the combination of overtaking of ingesta with the gas, that is what we call the bloat.
So how do I suspect, or how do I know that a rabbit is having bloating?
You will see engorgement of the stomachs.
In terms of like it grows in big size?
The stomach extends and expands to the abnormal size.
Okay.
So most times we manage that and we limit the feeding, so we get fine.
Is bloating something that can be worked on in terms of treatment?
Yes.
Oh, okay.
We do treat bloat with numerous drugs, including liquiparaffin and other managerial practices.
Okay.
Like less feeding in terms of treatment. That is how you can reduce the ingesta, and then the rabbit gets fine.
Any other diseases affecting rabbits?
So we have mange. We have mange. It very much disturbs rabbit. Skin mange is also a condition which is variable, but it is treatable. So whoever is there who can see your rabbits with a lot of scabs on the toes, mouth, muzzles, ears, so you begin to suspect the skin manges. But ivermectically, or by use of ivermectin drugs and antibiotics, we treat and cure rabbits.
Okay. Is there a correlation between ear canker and skin mange?
Yes.
Are they the same or they're different?
So there is what we call differential diagnosis. Some people can confuse
skin mange
and ear canker. But ear canker is another complexion. It is a bacterial disease of rabbits. But it is treatable and cures just in weeks.
Ah. Do you use the same treatment?
Yes, we use the same treatments for ear canker
and skin mange.
And skin mange.
Oh, perfect.
However, for the case, because ear canker being inside the ear, sometimes with the skin mange we can apply topically some sprays, but you cannot spray inside the ear because it can affect the eardrum and so what. So you find yourself using injectable drugs for the case of ear canker.
There's been a myth in rabbit farming. We see our friends in chicken farming where they vaccinate.
Yes.
Is vaccination something you do recommend in rabbit farming?
So vaccination, there have been always propaganda as if rabbits do share the same vaccines with
chickens,
avian or chicken, poultry, but it is not true.
Okay.
Rabbits are not vaccinated, but what we do what we call prophylaxis. So once in a while, we bring in probiotics, we bring in antibiotics, we bring in sulfurs, multivitamins to kill out stress to some extent, and to some periodic tables, as the farm arranges. But rabbits are not vaccinatable for NCD vaccines, as mentioned with farmers earlier.
So there is, what you're trying to say is there is no anticoccidiosis?
Anticoccidiosis, that is what we call prophylaxis.
Oh.
We just give them prophylactic treatments, but it is not, we don't specifically vaccinate coccidiosis.
Oh. Why do rabbits die a lot at 1 month, or basically after weaning? After weaning.
You know, that is the situation when we are trying to pull out the kittens from the mother to the new environment where they are not suckling, they are getting used to, they are really trying to feed on their own. So the complexion in mortality is always brought about by the management. So when rabbits are weaned off from their mom, sometimes they die because they overfeed.
Oh, there is no regulation whatsoever.
Yes, they overfeed. And in terms, you know, rabbit is an animal that can feed on anything you have given it. And it can eat wholesomely if it is not limited. That is why we get bloat. But young kittens, when weaned, they die a lot of bloat. That's why, because they don't get the limit to feeding. So with management in laboratory, it is normally a key to rabbit farming. If you can have proper hygiene, you can have proper recording, if you can have everything in time,
okay.
You feed in time, you give water ad lib in time. You know, rabbit is a white animal, white meated.
Yes.
They need a lot of water.
Okay.
It must ad libly have water all day night. So if you follow management,
you'll have chased away
you will have chased away majority of the diseases, majority of the challenges, and the majority of everything that can create a loss to a farmer. But I'm sure rabbitry business is a stress-free business.
Okay.
It is a completely stress-free business. So we are trying to exercise rabbitry to promote white meat production in Uganda. And with you, Dennis, I know everything will go right because you are more of
practical.
Yes.
So what we have, the take-home message from Dr. Badru is that rabbits rarely fall sick, but once mismanaged in terms of poor hygiene, poor feeding, unclean or unsafe water, you just have exposed the rabbits to falling sick night and day. So ensure that before we talk about the diseases and how to treat them, let's start by managing our farms and ensuring that everything is in check so that we chase the vet away from the farm. Of course, we need the vets once in a while once the problems have, gone beyond what we can manage. But let's first start by trying to manage the diseases that we have or some of the diseases that could attack our farms. My name is Dennis Duke Onyala and I've been talking to our...
And a new technique is coming to retire rabbit farm.
By the way, yes.
We're doing artificial insemination.
Oh, perfect. We are going to talk about the artificial insemination, but also don't forget to always visit these farms so that you get to learn before you start off. The Lutaya Rabbitry Farm is located in Masaka City, Bana Masaka. Come and learn, come and embrace this. Until then, goodbye.